CNA Practice Test questions and answers.
A CNA recognizes that meeting an elderly resident's emotional needs includes regular check-ins, keeping the call light within reach, fall prevention modifications. These measures primarily address which emotional need? A. Quality time. B. Sense of purpose. C. Safety and security.
D. Privacy.
Correct answer. C. Safety and security. These actions ensure physical safety and reduce anxiety about falls or neglect. Volunteering, joining senior groups, and exploring hobbies help fulfill an elderly residence. A. Sense of purpose. B. Privacy. C. Youthfulness.
D. Dépression prévention.
Correct answer. A. Sense of purpose. Engaging in meaningful activities fosters purpose and fulfillment. To respect a resident's decision-making, unless cognitively impaired, the CNA should A. Suggest legal counsel. B. Actively listen to their preferences. C. Ask them to consult a social worker. D. Encourage family input. Correct answer. B. Actively listen to their preferences. Active listening validates autonomy. Legal/social worker involvement is situational. A resident sleeping excessively, withdrawing from activities, and avoiding loved ones may indicate A. Anger. B. Depression. C. Frustration with staff. D. Alzheimer's disease. Correct answer. B. Depression. These are classic signs of depression, not cognitive decline, Alzheimer's. End-of-life care plans prioritize A. Strength-building exercises. B. Optimal comfort for the patient/family. C. Memory retention strategies.
D. Encourager knitting.
Correct answer. B. Optimal comfort for the patient/family. Hospice care focuses on comfort, not curative measures. When a resident exhibits behavioral disturbances, the first action is A. Arrange alternative housing. B. Ensure patient/staff safety. C. Isolate the resident. D. Call the police. Correct answer. B. Ensure patient/staff safety. Safety is the priority. Isolation or relocation are last resorts. A resident is yelling and crying due to a complaint. How should the CNA respond? A. Touch their hands and ask to calm down. B. Report to the charge nurse. C. Use a calm, reassuring tone. D. Walk away to let them cool off. Correct answer. C. Use a calm, reassuring tone. A neutral, empathetic approach de-escalates distress. A resident grieves the loss of a lifelong friend. How can the CNA assist? A. Encourage bingo to distract them. B. Share a personal grief story. C. Ask if they want to discuss feelings. D. Say, they're in a better place. Correct answer. C. Ask if they want to discuss feelings. Offering support without minimizing their grief is key. To prevent social isolation in nursing homes, staff should prioritize A. Increased protein intake. B. Meaningful resident relationships. C. Daily sunlight exposure. D. Solitude if desired. Correct answer. B. Meaningful resident relationships. Social bonds combat loneliness. Other options address physical, not emotional, needs. A facility's reasonable adjustment to honor resident preferences includes A. Letting them sleep past 6 a.m. B. Dictating meal choices. C. Limiting activities to board games. D. choosing TV programs for them. Correct answer. A. Letting them sleep past 6 a.m. Respecting sleep schedules respects autonomy. A resident becomes confused/agitated after dark. This is likely A. Dementia, B. Alzheimer's, C. Sundowner syndrome.
D. Psychosis.
Correct answer. C. Sundowner syndrome. Symptoms worsening at night align with sundowning. The primary emotional impact of COVID-19 on LTC residents is A. Family isolation, B. Fear of death, C. Anger over precautions, D. Anxiety about staff attire. Correct answer. A. Family isolation. Restricted visitation caused severe loneliness. A resident with delirium might A. Cry over minor schedule changes, B. Hear/see things others don't, C. Weaken physically, D. Lose speech. Correct answer. B. Hear/see things others don't. Delirium involves hallucinations or paranoia, not physical decline. Which is not an attention-seeking behavior? A. Attending all social events, B. Refusing family visits, C. Excessive call light use, D. Lying on the floor for help. Correct answer. A. Attending all social events. Social engagement is healthy. Others indicate manipulation. A resident manipulates staff by A. Complaining of pain to new staff, B. Lying to other residents, C. Refusing medications, D. Eating meals alone. Correct answer. A. Complaining of pain to new staff. Fabricated complaints to gain sympathy/attention are manipulative, which does not trigger mental health issues in LTC residents. A. Spousal death, B. Financial loss,
C. Health decline.
D. Faith-based activities. Correct answer. D. Faith-based activities. Faith groups foster connection. The others are common stressors. To calm a resident with delusions. A. Argue to prove them wrong. B. Offer complex explanations. C. Shift focus to another staff member. D. Listen non-judgmentally. Correct answer. D. Listen non-judgmentally. Validation, not confrontation, reduces agitation. Suspicious delusions are termed A. Scheming, B. Dreaming, C. Paranoia.
D. Dementia.
Correct answer. C. Paranoia. Paranoia involves irrational distrust, not just memory loss, dementia. Memory care units allow residents with dementia to A. Watch TV all day, B. Sleep unrestricted, C. Roam freely monitored, D. Visit family weekly. Correct answer. C. Roam freely monitored. Secure units enable safe wandering, a key dementia care strategy. Anxiety in LTC residents does not typically include A. Restlessness, B. Anger, C. Muscle tension,
D. Giddiness.
Correct answer. D. Giddiness. Anxiety symptoms include restlessness, tension, or fear not euphoria.